My name is Dr. Frederick Meyer. I'm the Eline Professor and Enterprise Chair of Neurological Surgery at Mayo Clinic. Previously, I was the Chair of Neurological Surgery in Rochester, Minnesota. I'm also the Executive Dean of Education of the Mayo Clinic College of Medicine and Science and the Dean of the Mayo Clinic Alk School of Medicine. And lastly, currently I'm the Executive Director of the American Board of Neurological Surgery. I came here many years ago, as you can imagine, as a very unqualified medical student. I was fortunate enough to match at Mayo Clinic, trained here, did a fellowship here, and was honored to be invited to stay on staff. And have been very fortunate to have developed and cultivated a very fine clinical practice and career based on the platform of Mayo Clinic and neurological surgery. My clinical practice is really what I would call cranial. I do a lot of brain tumors, including skull-based tumors, pituitaries. I do a lot of vascular, from bypass and aneurysms to AVMs, recognizing that nowadays endovascular treatments have eliminated much of that because I'm not a dual-trained neurosurgeon. I'm mainly an open cranial surgeon. But I still do a fair number of bypasses, let's say for Moyamoya disease, aneurysms that can't be treated with endovascular techniques, cavernomas, etc. And as I said, brain tumors and other sorts of cranial problems. Rarely I do spine, mainly on the spinal tumor side of things. What I like most about our residency is we have great residents. They're engaged, they're bright, they're friendly, effective, efficient, inquisitive, innovative, and team players. That's what I look for, someone who's going to contribute to the betterment of our patients and of our department. The other thing I like about our residency program is we offer a lot of scholastic opportunities and career development opportunities. So for example, if you happen to be interested in being a spine surgeon, then you can do an Enfolded Complex Spine Fellowship. Work with spine surgeons across Mayo Clinic. Wearing my enterprise neurosurgical hat for a moment, it's important to recognize that we have 3 great programs in Rochester, Minnesota, Florida, and in Arizona. And as a resident in Rochester or in any part of Mayo Clinic, you can rotate from site to site. Those trips are subsidized and you can train with the best in subspecialty expertise. For example, if you had interest in, let's say, pediatric scoliosis, you'd want to spend time with our colleagues in Arizona. If you had an interest in brain tumor, in addition to working with our great neurosurgeons here, you'd want to spend some time in Florida working with Dr. Quinones and Dr. Kaisan, for example. So a lot of opportunity. There's a lot of internal flexibility. If you have an interest in obtaining a dual degree, that sort of falls in my watch under the College of Medicine and Science, and there's ample opportunity to get master's degrees or doctorate degrees if you so wish in various disciplines like artificial intelligence, regenerative science, individualized medicine, genomics, biomedical ethics, etc. So flexibility is how I would describe our residency. The other thing I like is there's much more of a mentorship program. You work one-on-one with neurosurgeons in a rotational fashion. We are not a university-style training system where you have group services. You have more of an individualized mentorship program, which I think is a value-added and advantageous. Well, I'm at work a lot. When I'm not at work, I guess I spend a lot of time thinking and trying to raise kids. I have 6 kids, and that keeps us busy, especially since my wife is a neurologist at Mayo Clinic. So I put a lot of time into my kids, which I hope all of you will do if you are fortunate to have a family. Beyond that, I'm a pretty firm believer now in exercise. So I ride my bicycle to and from work each day, and then I go to CrossFit 5 to 6 times a week to try to keep these old joints loose and vibrant. There's a lot of outdoor activities within the Rochester area. I, for one, like fly fishing, and there's fantastic sort of chalk stream rivers south of Rochester by 20 minutes. As I said, there's a lot of bike riding outside. I did a 30-mile run on Sunday, rather a 30-mile ride on Sunday with lots of open roads. In the wintertime, there's some downhill skiing. There's a lot of cross-country skiing. If you like snowmobiling, that's also an opportunity. We have a fantastic gym system within Mayo Clinic that you're all open to join at a very low cost due to subsidies from the College of Medicine and Science. but we also have great gyms in the area too. So I would say, at least for me, athletics outside work is an important part of wellness and health. And I would encourage all of you to pursue those extracurricular type of activities to stay healthy and live a long and fruitful life.